All right. So the question is, why or when do we incorporate upper quarter Y balance test in maybe a lower body injury, or why is that maybe in our lower body checklist? And so a couple things we want to think about with that is number one, there's tons of research, for example, in patellofemoral pain, that core function and hip function is really important. There's research in ankle sprains that core and hip function is decreased. And one of the things I think we forget about are kind of that fascial alignment that we see with the entire body. It is not, it's, yeah, the quad contracts and fills its fascial volume there, but it's the reason that it's tensioning that fascia there is so that it can tension the fascia also into the glutes, and the glutes can tension into the thoracolumbar fascia, which tensions into the lats. And, and so when we think of those anatomy trains, if you will, that all goes together. And so, for example, I think one of the best tests for quad function, as a surrogate of quad function, is trunk stability pushup. Like trunk stability pushup, you're tensioning the whole system from fingertips to toes through the core. Well, the quads are on the way in the lower extremity, and if you can't tension the quads symmetrically and well, your trunk stability pushup's not going to be good. So similarly with the upper quarter Y balance test, now we're taking that symmetrical trunk stability pushup pattern, making it asymmetrical, unilateral, and going to the limit of stability, which again requires that nice integrated timing of the quads and things like that. Now, is there direct research or a direct connection that you're going to say, okay, upper quarter Y balance test relates to ACL tear or that type of thing? Not a lot of direct research. We have research in the military that the upper quarter Y balance test in the military population is one of the risk factors for injury. Not doing well on the superior lateral reach is a risk factor for injury, not just upper extremity injury, but a whole body injury. And so I think, there's some there, and it's more about too, like making sure the entire system is functioning well from head to toe, not just looking at an isolated quad or an isolated gastroc or just lower extremity power testing. So that's kind of the rationale behind it.